Hello and welcome to all of our viewers around the world. I'm Fiona Lang Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, we have a very special guest here today. Justin Roche is here with us, going to be speaking at our upcoming tongue tie conference. We're so excited, Justin. Honestly, when these things come around, well, you just have to grab the opportunity. You are going to be here, and as part of our presentation, of course, you are going to be our keynote, which means that everyone anywhere in the world, wherever they are, can come and listen to you for absolutely free. It's exclusive. I mean, it's just amazing. So that is just all complimentary to all the incredible work that you've been doing in Ireland. And so I'm so glad to have you back. Thank you for joining me again here at Gold.
No worries. Thanks very much for having me. Yeah, I think it's gonna be magic. I'm really looking forward to it. And I suppose the fact that everyone and anyone can get access to it, I think is really, really cool. It's gonna be brilliant.
Yeah, it is sweet. And I think, I'm eager for people to get education in front of people that they can take away, they can use in practice, they can work and educate, with their families. It's so valuable today, particularly in this area of work that we're doing, not only as IBCLCs, but there's so many people that actually, work with families today. Your presentation, Unraveling Tongue Tie, Surgical Insights, and Lifelong Health Implications. Justin, tell me about this lifelong health implications because, we are starting to see some research. We've got some, research that is older. Now we're starting to see some newer research again. Was it always something that you were thinking about, when someone presented to you? Were you always super engaged with these lifelong health implications in that moment? Where did you start and where are you now?
I suppose, well, I come from a typical kind of pediatrician background, which
Sure.
is we're trained in, tongue tie is not a big issue. It might cause speech problems later, but sure, most of them, they'll stretch by themselves. These children will fix themselves and everything
Right.
will magically go away. And certainly, I suppose that's where I started from. It's because of our family experience is, I suppose, really what gave us that insight into actually tongue tie. There is something going on there. And I suppose it really started for me. I thought that this was about getting a few more babies breastfeeding.
Right.
And I suppose once we started working with these families, and then you start to realize, well, actually, if good tongue mechanics for breastfeeding makes a difference, then there must surely be babies out there who are bottle feeding, who are having similar problems. And so I suppose that got us started on that kind of pathway. And then people started asking about their older children who said, well, but our 4-year-old had exactly the same problems that our baby is having,
Right.
had when they were younger. But, what do we do about that? So I suppose, and having been to other conferences with, say, ICAP and IATP, you really, I suppose, realize that there is a much bigger picture. And the babies that were missed become the fussy feeders, the picky eaters. Some of them have speech problems, some of them are snoring, the behavioral issues, and all those kind of bits. And I suppose it's, as we then got into doing older children and then adults, you really started to see the impact that tongue tie has throughout the lifespan for these
Right.
people, but equally the difference that we can make,
Yeah.
if we intervene, but and also that intervention needs to be more than just surgery.
Right.
If you can get so far doing just tongue tie release, but there's a whole load of other bit that goes around it, and it's not about just making it more complicated or more expensive for families. We've got to get them to change what they're doing in order to get that function back to normality. And
Yeah.
also, if we get that bit right, the other thing we're seeing is they heal better.
Right.
So, they keep that, I can give them a great release, but if they don't move it and use it well, you will lose some of that gain that you could
Right.
have got, like in that. So yeah, I suppose it's those bits. And it's, just over time, I suppose, we've changed so much of what we've done over the last kind of 15 years, and there's
Yeah.
always more ideas. We're forever looking
Coming
like,
all
well,
the
that didn't
time.
work as good, and could we do
Yeah.
this different, and all that kind of bit. But yeah,
I
so
love it.
obsessed is
Yeah,
the bit.
yeah. I mean, there is an obsession. I think the obsession for most of us who work in this field is that we We want to know more in order to do better. We're very passionate about, caring for families. And, for us here at Gold Tongue Tie, it is about educating, people around the world. And I think when we come together collectively, this is the responsibility I see, is that if we're not coming, then we're never changing, we're never growing. When we come together as practitioners, I think that's why, you referring to other events and conferences and seeing the research, starting to develop, in really great areas is so valuable for each and every one of us. And for all of those folks who are still sort of learning or wanting to know more, this is the opportunity. We're definitely in a better place, I feel, than we were 10 years ago. But there is so much that has changed in the last 10 years, the last 5 years. How is it received there in the general community? Because there's a lot of people talking about this around the world. Obviously, we're seeing it, but is it still niche, as some people reflect on? What is it that you're seeing? Do you have lots of support in the community? I know you're very busy in your clinic as a whole, but tell me a little bit about the dynamics that you're dealing with when it comes to that professional sense.
A lot of it depends on, I suppose, which professions you're looking at.
Sure.
So I think there's still a lot of kind of doubt or reservation, even within the kind of pediatrician side
Yeah.
of things. Um, we would find that a lot of the body workers would refer, babies and older children into us, I suppose, because they're seeing the impact that tongue tie has on the
Right.
body at large as well.
Yeah.
Same as, there's a number of lactation consultants who would refer in as well. But
Right.
so yeah, it is there's profession bias, I suppose, in terms of how people still view tongue
Right.
tie. I think some of it is that my colleagues are looking for that very high level of evidence that is really difficult to get
Yeah.
because the perfect study, which is we treat one group and we observe the other group, is the study that's impossible to recruit to.
Right.
Nobody's going to turn up to a tongue tie service with the idea of, well, this might help my baby, and
Right.
then be offered a treatment or a treatment arm and a supportive arm with observation. Do you know what I mean? It's
Yeah.
like, well, if you believe that releasing a tongue tie might help my baby,
Yeah.
then crack on and do that. Do you mean there will be some people who are happy to stay in a
Sure.
non-intervention arm, but most of the families, by the time they come to see us, have tried all that supportive care.
Yeah.
There's not, families don't rush in to having surgery on their babies
No.
unless they've experienced it before and they've seen the difference that it can make. Do you know what I mean? So that
Yeah.
they're making that more educated guess or estimate, and they're looking for assessment. They're not like,
Hmm.
do my baby's tongue tie? They're saying, does my baby have a tongue tie? And if it does, will you then treat them? You know what I mean? Um, but and in the same way as there's still this myth that it's a social media phenomenon. Do you know what I mean it's
Right.
trendy to have a tongue tie? I have yet to meet the family
Hmm.
who have come because it's the thing to do. Do you know what I mean? That's
Right.
on their bucket list. They're
Yeah.
coming, they may have got their information through social media,
Right.
but they're not coming because social media told them, you need to find a tongue tie in your baby and get that tongue tie treated because that's the trendy thing to do. You know what I mean?
Yeah.
And if I meet that family, I know exactly where to send them,
Yeah.
which is not to
Yeah.
treat them.
Yeah. No,
They
for
need help
sure.
in another direction. So I think it's an easy way of dismissing some of that kind of concern, or even the fact that the trend that we're seeing is that parents are asking these questions. They're looking for advice, they're looking for support, they want
Hmm.
to know why their baby's not happy, why they're struggling to feed, why they're not gaining weight, why they're windy, why do they have colic, why have they got reflux, all those
Yeah.
kind of questions. Why are none of us sleeping? Well,
Yeah.
whatever that might be. They're
Exactly.
looking for answers to why they are struggling. So, but yeah, they're not coming because Facebook told them to. That's for sure.
No. No, and I love the fact that that is, for me, that's been the biggest shift that I've seen in the last 5 years, is just the fact that parents are getting more savvy about asking questions. They're actually getting quite demanding in a sense that, they're not waiting. They're not just and they're not just waiting from one person to tell them something. They're seeking answers if they, if and so I feel like less people are falling through the cracks when it comes to these things. But clearly we know that, there are always gaps, in care. That's the bottom line. But the hope is, I think, even with you and your clinic with Kate, is that, you're narrowing that gap, that you're providing a service, for people. And it is very interesting what you said. Yeah, I've never had a client that I've ever sat with that has somehow made something up, or just perceived it or something. It's, their concerns are always valid. So yeah, that's a really good point. And that's definitely something we've seen a shift for here as well. Well, I think, this ultimately, having you here at this event is really just we're very fortunate to have you. I know how busy you are, but really taking a deep dive into, what we have seen, what we know, and now these, lifelong health implications. I think, like you, we're seeing it as well. We're seeing parents who have had this their entire lives and never been treated, and now they have a newborn, with it, and so they're connecting the dots very quickly that in fact this is what they had suffered from, when they were an infant as well. And it is true. It affects no matter how you're eating, whether it's breastfeeding or bottle feeding or introducing solids. You'll see problems if there's a tie there, and that's something that's coming up over and over again.
Yeah.
Justin, it's so great to have you here. Thank you so much for taking the time to sit down with us today.
No worries. Cool. Thank you very much. I'm looking forward to it. It's going to be good.
Yeah, absolutely. And if you would like to come and join us and listen to Justin's presentation, you can register right now today for free. So that means you can head over to the website to goldtonguetied.com, register for Justin's event. We also have Melissa Cole, who's going to be opening up also free and open access. Absolutely amazing opportunity to come and listen to this education. Then you can share it out on your socials, with all of your colleagues and friends as well, to come and join us for this great opportunity. Thank you again to Justin Roche for being with us here today. And of course, to all of you for joining us, our viewers. We'll talk to you all again very soon. Bye bye for now, everyone.